morning, I'm Dr. Deuk. I'm here with one of my lovely patients who had a thoracic herniated disc that we fixed with the Thoracic Deuk laser disc repair. And she was one of my first that we did. I think I've done 6 now to date. It is October of 2020. And prior to 2020, I'd never done a thoracic disc herniation with the posterior transforaminal approach. And, you know, for the surgeons out there that may pick up on these videos and techniques long after I'm gone, I use the cervical system from Wolf to do the thoracic disc herniation. I did not use the lumbar system, it's too big. So I use the cervical cannula, the cervical dilator, and the cervical scope. And the cervical scope that I use is the older model, and I don't like the newer one because it's kind of bigger. And Wolf doesn't like me for using the old one because they want to make money selling new ones, and I won't use the new one because the old one I think is a better scope. So now that I've introduced my equipment that I used, just remind our audience, if you don't mind, what kind of problems you're having with your thoracic disc herniation. Tell us what number it was, and how long you had symptoms, and what kind of problems you had before surgery.
It was my T9 and 10, and it had been 7 years since my accident. And I was having wraparound pain along the rib cage, and it was radiating into when I breathed and when I bent over and when I did just about anything. And that's all gone now.
It's all gone.
All gone.
7 weeks since you had the surgery.
7 weeks since I had the surgery.
Yeah.
It was gone the day of, and it was nice to come in halfway through and be in pain in the morning and then have the surgery and go home, and it was gone. It was wonderful.
How much am I paying you to tell everybody it's gone?
Not a cent. I'm paying you.
That's right. So, cured of your thoracic pain. And there's literally thousands and thousands of people out there in the world that have thoracic disc herniations and live with that pain because it's a very difficult problem to fix. And when I was taught how to fix it, it was always a massive surgery with removing a rib and getting the disc out and putting in a cage and screws and rods in the back, which actually had a pretty high mortality rate in the hospital. A lot of patients wouldn't even make it through the surgery, probably about 15%. Wouldn't get out of the hospital because of complications from that kind of major surgery. So we did it with a tiny little cut on your back, and we did it arthroscopically, endoscopically, transforaminal. And here you are. And what have you been doing now over the last 6-7 weeks? How's your life changed as a result of the Deuk laser disc repair?
It's nice to be able to participate in my kids' lives and do things and, you know, help cook dinner and help clean the house and help, you know, do things minorly. I mean, still healing, but there's no pain, so it's now I can do anything.
You can be a mom.
I can be a mom. I can definitely do that, yes.
Yeah, so pain that people live with, especially with family members, it kind of robs you of your dignity of being a family member, doesn't it?
It does, and my kids very much saw that. You know, mom's always laid up, mom's always in pain, mom was taking medicine for her pain. And that affected my kids. And, you know, now they're going to get to see me in a new light, which is wonderful.
Yeah, it's the most important thing in the world is those relationships and that time with your family members. And for you to be whole as a person and be able to do the things that they want you to do, you want to do for them. So that's why I do what I do.